It was ground zero. Her name is Sandra Dial. I talked to her the other day. She seems to have changed her mind. She's not much interested in talking about this particular issue. There's something strange going on here. There's a clear association, and there are other people speaking out. So I'm hoping a little bit of public attention to this will put some pressure. I know the minister will be reviewing this matter with her officials, but I think that we need some warnings. So I'm putting a warning out here. It's not the first time, frankly. I put a warning in my own household. It went out to 50,000 homes in 2005 and again in 2010. I asked people, if you're on a medication that would increase your risk of extending your 3-day stay in the hospital for a minor surgery to 3 weeks, you might end up with an unnecessary bowel surgery. Would you like to know? And most of them said yes, they would prefer to know. I think Health Canada actually has an obligation to warn people. People have a right to know when their life is at risk. And if I may, thank you, I just want to close with an analogy. We have other public safety issues in Canada that are going on right now. There's train safety issues and calls for review, Transport Safety Board involved. We have recalls on car, ignitions for GM and brakes for Chrysler. These things go on all the time. There is no other sector where such a cavalier response to such a significant risk factor would go unchallenged. This is like if it was Transport Canada, we have 5 or 6 crashes a year in our country, posting a notice on the pilot's chat line asking the boys to please stop drinking in the cockpit. There's a possible association. We're not sure it's associated. It could be associated. It hasn't been ruled out yet. And frankly, I think it's unconscionable that this has gone on for 10 years. It's a lot of deaths. And I'm calling for clear warnings to the public, clear warnings to the patients, and much stricter control of these medications called proton pump inhibitors. I'll pause there and ask if there's any questions.
My name is Kevin Maker-Vokes. I'm a freelance reporter. I was hoping to be able to get a bit of an idea from yourself, at least besides just C. difficile, what other concerns, or are there other concerns that the proton inhibitors are actually causing?
Well, yes, there are many concerns. Number one would be the increased risk of fractures, and it's clear that that was because of the failed. If you're depressed acid, you don't absorb minerals well. You also don't absorb or digest proteins properly because it doesn't trigger the necessary response from the stomach to break the bonds of the long chain proteins. So you end up with absorption problems in the lower GI tract, and that can lead to a whole host of other problems down there. You're also letting a lot of other pathogens through into the lower GI tract when acid is suppressed. So there's a whole range of lower bowel and colon issues that can result from suppressed acid. I mentioned cardiac arrhythmias from hypomagnesemia and so on. The list is piling up. And in fact, the fact that it recently became apparent that prolonged use leads to dependence in the sense that when you try and get off them, you get a rebound hyperacidity that will very quickly convince the person who doesn't get good advice that in fact they need to stay on them long term. So there are very serious issues related to this. Others have been raising the concerns, and I think it's time we had a much better response from the regulator. And I'm hoping that that this conference today, and with some help and with some interest from some measures of the media, that in fact we may help to find out why exactly it is that the regulator has more or less downplayed this issue for 10 years. And while many are puzzled over why these infections are so hard to control, because they pitched it as a highly communicable disease, it's quite clear now that it's not. The bug's in background condition in most of us in small amounts and hardly ever made anybody ill until the widespread use of acid-suppressing drugs.
And as part of that, I mean, I guess this raises a much larger sort of question, which is when it comes to the prescribing of the any sort of anti-acid, is for things like acid reflux, etc. But is perhaps and with people coming to the doctors, perhaps with this as an issue, is there maybe a reason why we're seeing an increase in this?
Okay, that's a very good question. Yeah, it's common in the developed world where we have eating problems. Number one, overconsumption. Number two, alcohol on an empty stomach, coffee on an empty stomach. Interestingly enough, the symptoms of hypoacidity or hypochlorhydria is the way it's referred to in the literature, or achlorhydria, are almost identical. You can end up with GERD or with reflux because of low acid, interestingly enough, And any acid in the esophagus will cause discomfort. And so I've seen editorials going by where some doctors are re-examining the whole notion of suppressing acid and saying, it's actually not too much acid that's causing the problem, it's displaced acid. Since your stomach has a protective membrane, a mucous membrane, beautifully designed to protect you from acid, but the esophagus does not. And so you want to keep the acid on the lower side with the food. And there's also interesting evidence that, in fact, it's the acid that causes the sphincter, the cardiac sphincter, to tighten up, or the esophageal sphincter, if you will, as some call it, to tighten up and therefore keep the acid down where it belongs. It's a very high pH, as high as 1 when you're digesting your food. That's battery acid strength. You don't want that in the esophagus. But if your sphincter is not getting the stimulation of sufficient acid, then it doesn't get enough exercise. It can be sloppy. Food's taking too long to digest. And of course, therefore, when you lay down at night having eaten too late, especially if you had alcohol or coffee on an empty stomach, it takes forever to digest it, and you may end up with reflux that could be managed by conservative means. One editorial saying that, in fact, it's an anomaly when you have a displaced acid, but treating one anomaly by creating another suppressing acid just doesn't work out well for the patient in the long run.
So I guess, and this becomes a much larger, once again, one of these larger sort of questions. So it's a matter of not just, obviously putting on the labels, letting people know about this, but it's also something that it sounds like we have to deal with as just generally within societally that, maybe it's not a good idea to end up drinking, pop or something that would be late at night before one goes off to bed or something to that effect.
Yeah, exactly. It can be managed by diet, by managing your eating a little better. It's well known that actually enjoying alcohol is a good thing, but on an empty stomach, not good, especially repeatedly. And in fact, the first cells to be inebriated are the ones that release the acid. And that leaves you in a big problem if you tuck into a big meal, especially with a lot of protein.
And now finally, when it comes to going back to the main point, which is the role of the regulator in this, so you would like to end up seeing clear labels that can end up saying, well, look, this is what the risk is, and have this explained to physicians? Is that...
Well, I think that's going to take a little bit of work. And in fact, it was Mark Twain that had a quote there: when you've been going the wrong direction a long time, and you're considered the expert, it's hard to admit you've been wrong about something. But I think when public health and public safety is at risk, we have to do the right thing. And yes, I think we need very strong controls on the prescription of these drugs. There are some conditions that are listed in this editorial I mentioned, failing the acid test, like Barrett's esophagus and Zollinger. There's a syndromes. There's various syndromes where you might in fact need to take these certainly for a severe stomach ulcer for a short term to allow healing. The use of PPIs is very appropriate under those circumstances. It's the long-term use that creates dependence, sabotages your digestion, and creates a whole host of problems downstream.
Just a question regarding the fear of esophageal cancer. And is the medical profession, are they seeing proton inhibitors as the only solution, or do you know of perhaps natural ways that we can also fight the fear of esophageal cancer with controlling our stomach acids? Is there natural products that can actually help that?
Well, first, proper management of stomach, so you keep the acid on the right side of that sphincter, is extremely important. It's inflammation that in so many cases is highly associated with the risk of cancer. So chronic inflammation from acid assaults in the esophagus is what the concern is. And if you keep the acid on the right side of the sphincter, it's not an issue. So suppressing acid actually, interestingly enough, actually encourages reflux of higher pH or dilute acid material, because the sphincter is not responding to the appropriate acid that would normally be there at a higher level of acid content that's necessary for digesting your food. So those risks, I think, can be managed, and perhaps the fears have been exaggerated and can be simply managed a better way through proper digestion management, some digestive aids, and making sure people actually get the nutrients they need by proper digestion rather than sabotaging the long term their digestion by shutting down the essential role of acid in the stomach. Okay, thank you very much.